I'm Giuseppe Boriani. I'm professor of cardiology at the University of Modena and Reggio Emilia, and I am the PI of the Aristoteles project. I decided because it was a great opportunity for our university, for our community. We will test the impact of artificial intelligence in atrial fibrillation, which is a very common disease. So there are the possibility for a growth in our knowledge and a growth in the ability to treat appropriately patients with atrial fibrillation, which are complex patients who can have many comorbidities. So it's difficult to take clinical decision in this type of patients. I think it's to put together the data that come from big trials to the decisions we have to take in our practice in front of a single patient. So we have the general knowledge, but we have to translate this into individual decisions, taking into account the preference of the patient, his values, as well as the risk-benefit ratio. So it's translation from general concepts into single decisions in the perspective to offer the best we can offer to our patients. There is a very high potential for artificial intelligence, but its use in medicine is not simple because we can have prediction of the evolution of the disease, and this is the target of our project. But we should also be careful in maintaining the decision in the hands of the physician. So the first step will be to provide physicians with more information, to leave the decision in the hands of the physician. And the physician should continue to be responsible for the decision without delegation to artificial intelligence of the responsibility. And this is the first step. Later on, we will have to test if the decision taken by an algorithm based on artificial intelligence will be better than the decision taken by the clinicians, but this will require a much more complex validation. I think there will be a growth in the ability to translate basic science into information for guiding clinical practice. There will be a complete change in the way how we perform clinical trials because we will have an increased use of modeling, also using artificial intelligence to explain how will be the future of a patient, the outcome of a patient when new treatments will be applied. So there will be a great change and artificial intelligence will be a protagonist, but the major driver will be how we employ artificial intelligence. It's not artificial intelligence per se, but how we implement it into daily practice. I'm a professor of medicine and I'm very happy that our young colleagues who are starting clinical activity and research will have the possibility to learn how to implement a big project like Aristoteles. So I'm very happy that our group is actively participating to Aristoteles and will be in touch with many other centers across Europe to gain the goal to finalize our project in the best way.